Hey everyone, this is Jason from Intricate Art Spine and Body Solutions. You can check us out at intricateartseminars.com. I just wanted to talk a little bit today about incontinence, right? Urinary incontinence particular. So incontinence is one of the things that really bothers me in the medical community, because no person should suffer from incontinence of any type, especially urinary incontinence, right, without any type of underlying significant pathology, right? So like a spinal cord injury or significant prolapse or something like that. Unless you have some underlying damage to your system, nobody should have incontinence, right? So 99% of the people that are using adult Depends probably don't need to be using them, or the night catheters, right? I hate hearing about those commercials, because all those most of those people are suffering needlessly, right? And one of the major problems with this area of medicine, like with a lot of areas of medicine, is the general medical community either doesn't care or they don't know that incontinence is easily treatable, right? And neither one of those are acceptable, but that's just how it is, right? So what people get told when they have incontinence, especially if they're older, right, or especially for women if they've had children, is that it's just normal, and it's not. That's complete nonsense, right? It's total crap. So dry needling is the best treatment for incontinence that I believe exists on planet Earth right now, right? So the pelvic floor musculature in both males and females is innervated by S2 to S4. That's to some degree or other by S2 to S4, right? So there's about 9 pelvic floor muscles, all innervated by some degree of S2 to S4. Remember, S2 to S4 is a parasympathetic dominant portion of the autonomic nervous system, right? So human beings in general suffer from sympathetic hyperactivity, right? Mental stress, physical stress, any type of tissue damage, all of that causes sympathetic hyperactivity. And it just so happens that the vast majority of people that suffer from urinary incontinence also suffer from sympathetic hyperactivity, right? So we can see different parts of the brain. There's one in particular in the pons called the PMC, the Pontine Micturition Center, and that is a primary urinary control center, right? And on functional MRI, we can see that part of the brain with hyperactive spontaneous electrical activity going through there, right? And then there are some really good acupuncture studies looking at this. When certain needles are inserted, right, the functional MRI image of the brain after about 5 minutes or so looks normal. So it's really amazing, right? So even if you're suffering from urinary incontinence, or you're trying to treat urinary incontinence and you're not needling, or you haven't been needled, you are not getting the best results that you can, or you may not be getting any results at all, right? I can't tell you how many patients of mine, or students even, that I see that have had decades of urinary incontinence problems, and they've been treated on and off over the years from different therapists, right, pelvic health specialists, without really any results. And in a couple of treatments, they're 100% better after they get needled. And that sort of holds true for the whole body, right? So the only direct treatment that we have to soft tissues in the body without needles is the skin, right? And at a certain point, musculature just stops responding to passive indirect treatment, right, which everything is without needles. So the major problem with urinary incontinence, right, is sympathetic hyperactivity of the autonomic nervous system, which almost all people suffer from anyways, especially people with pelvic health issues, right? And the inability of the muscles to function how they can, right? So this is a big area of misunderstanding with physical therapists and with other practitioners, right? So people's pelvic floor musculature, for the most part, doesn't need to be stronger, right? It's already strong enough. It's just being inhibited from functioning at the proper level, right? So if you have knots in your pelvic floor musculature, they're going to be short, right? It's almost impossible to stretch the pelvic floor musculature because they're all attached in a small area in the pelvis, right? So the pelvic floor musculature are all basically, aside from the obturator internus, are in between bones that don't move all that much, right? So it's really important to be able to needle them, because you can't stretch them. Most people don't feel comfortable doing a lot of manual hands-on treatment to them, right? And they respond extremely well to needling. So you can directly needle the vast majority of the pelvic floor structures. It's extremely effective, right? So one of the other things that you really need to think about when you're treating urinary incontinence people is directly targeting the parasympathetic portion of the autonomic nervous system, right? Since most people have sympathetic hyperactivity anyways, parasympathetic stimulation is helpful for just about all medical impairments, right? It's especially necessary if you want to fully resolve urinary incontinence, right? So if you allow the sympathetic nervous system to stay dominant in both the CNS and the ANS, the pelvic floor musculature is never going to work because sympathetic hyperactivity depresses parasympathetic activity, right? And the pelvic floor musculature are innervated by a parasympathetic dominant portion of the autonomic nervous system. So that, with sympathetic hyperactivity, that's going to chronically inhibit the pelvic floor musculature from working, right? So the problem is not their actual ability to work, it's that they're being hindered from working how they can, right? So by normalizing the autonomic nervous system towards homeostasis, and by normalizing the physiology of the pelvic floor musculature, which needling does extremely quickly, faster than any other treatment, you will see amazing results with people that have had urinary incontinence for years and years and years after just 1 or 2 treatments with needling, right? And the major reason, I think, or the 2 major reasons, is that with needles, we're directly touching the tissues, and we can also directly target the parasympathetic autonomic nervous system, right? So needling has a much more powerful effect, homeostatic effect on the ANS than any other physical therapy treatment does. And then especially if you know how to target other areas of the parasympathetics, like in the ears and in the upper cervical spine, if you connect those treatments with actual pelvic floor treatments, you guys will see results in a hurry when you haven't seen results in a long time. Right, so if you're a person with incontinence, or if you're a practitioner looking to learn more about treating incontinence with dry needles, you can check us out at our website at intricateartseminars.com. Right, and oh, just a little aside, you guys. I know it sounds like a horrible idea to get needles poked in your pelvic floor, and you're probably smart for thinking that, but it is really counterintuitive, right? So needling in the pelvic floor is the most comfortable area of the body. So just wanted to throw that out there. So don't let that scare anybody off. Get a hold of me if you guys have any questions. Jason at intricateartseminars.com. Thanks.